Hey everyone, welcome to Fat Mascara. I'm Jen.
I'm Jess.
We're here on a Friday. It's like the last day of school, Jess.
Well, last day for a few weeks.
Just for a few weeks. Exactly. So we're bringing you this interview today, but then I am going on an epic adventure. I'll tell you next week because we have some replays and I'll tell you where I am. It's fine. But next week we're going to be dark, no new episodes. The week after that, we will have some replays. You'll find out where I am. Jess is taking some time off towards the end of August too. We'll be back the last week of August with new episodes. But this one, our last episode rounding out our summer season, is I guess summer appropriate, because we're talking about the body.
It's all about the body, Jen. The body.
Who do we have? Tell me about Dr. Neinstein.
Okay, I'm very excited. We have Dr. Ryan Neinstein. He is a board-certified plastic surgeon in New York City, and he is the owner of Neinstein Plastic Surgery. So we wanted to really get somebody who knew all about, a super specialist, and he really knows the body. He's all about the body, and he's also really known as the surgeon's surgeon, because a lot of plastics, as they call them, plastic surgeons, they choose him as their own doctor when they're getting surgery. So he's the author of many safety guidelines. He's a masterclass instructor. He is an entrepreneur, and he also talks around the world about how to really, lead in this category. Dr. Neinstein is really known for hyper-specific procedures that you're not going to be hearing about or reading about anywhere else. He's really known for very proprietary procedures. So he's going to be talking about that in our show. And he's just a really interesting guy. He's a surgeon, but he's also very much a family man too. So just a really exciting interview, and I'm very happy to have him on the show. Dr. Neinstein, you are the body guy. Everyone's saying, if you want body, you go to Neinstein. How did you become the body guy, and what made you so into this?
Well, thanks for having me on, guys. I very much appreciate it. I love your podcast, and I can't wait to share the things we do over here. I like body surgery because it just makes sense to me. My energy, my vibe, the thing, I connect with the people. These are my people, and the people we work with, the people we operate on. These are people who care about the way they look and feel, that mind-body connection matters. And they really understand the concept of the limitations of diet and exercise. And for me, that comes out in the body. I can starve myself as much as I want. My flanks, my wife grabs them every day. They remain there. So being able to help people reach that final mile of their body just makes a lot of sense to me. And another reason why I like to do it is there's so many areas, and it keeps the operating room full, and there's just a wide breadth of body parts to do. So the face is a little limited to a few areas.
Question, Doc. Okay, so you said you relate to those patients, the body patients more. Is the body patient, I'm speaking obviously in big generalities here, but is the body patient different than a face patient? I'm sure people who get their faces done, as people who go get facial plastic surgery, are often, there's some overlap. They're going to get some body work done too. But are there two camps of patients, a body patient and a face patient?
So broad strokes, we tend to we want to hang out with people like us. We want to associate with people like us who are into similar interests, are going to be the type of people you want to spend time with. Mm-hmm. And I find a lot of the people that are seeking body surgery are people who are into fitness, into wellness in that sense. And that's something that aligns with me. Especially,
you're married to a trainer, right?
I'm married to a celebrity fitness trainer who's now the celebrity mom of my life because she's taking care of our young one. And we have one coming in a week. So there's a lot of action there on the baby front. And that's another reason, we do a lot of mommy makeovers. And it's another way I connect to these moms. I'm living it. This is the things they're saying, and their concerns are something I see every day at home. So
okay, we're gonna get to the mommy makeover for anyone who's got questions about that.
And that's why that world or that sphere makes sense for me to live in. And all my friends are face surgeons, so I like to do something different.
Okay, and it was interesting you said that there's no shortage of patients coming into the OR because there's so much real estate.
Correct.
You don't just
And
have
I'm
a
gonna
nose
You got your
that
toes, you got your
I'm
knees.
also like a nooks and we joke like I'm like a nooks and crannies guy. Like I do a lot of calves, a lot of ankles, places on the body that other people just like don't even know that you can do. We've kind of created the systems, the processes, the techniques to do them safely and predictably. So I like the nooks and the crannies, kind of a crafty surgeon like that.
So like what's I don't want to feed into anyone's like body dysmorphia here or like even fuel my own, but like I don't have body dysmorphia. But like
what nook should I worry about now?
But like
I
remember when I was at Cosmo, my friend, I'm not going to name check her, my friend and I would like, he'd be like, this is like a weird, like I've got like a little like side knee, got like a little like sidecar knee, like we always like find like little nooks and crannies. I know I'm going to get some DM or some email like, Jess, don't
send them my way.
But yeah, like we know what I'm talking about.
You just redirect them over here.
Okay.
But, you
do the talking, the toxic talking.
Exactly. I love it. We'll take all comers. Things like that really bother people, by the way. Like there's like fat, like thick calves and ankles where women have this, thick, almost like rigid, elongated structure that doesn't have any curves. And these are women who have low BMI, very fit, very thin, and they're just genetically designed to have fat calves and ankles. They don't like wearing shorts. They don't like wearing skirts. And the traditional thinking was it was a dangerous place to get to.
Yeah.
And that it's not, I've custom designed the instruments. They're like these baby little tools. We don't do pediatric lipo. They're just small, the instruments. Okay. But they get...
Thank you for clarifying that.
I just want to make it clear we do not do baby lipo. We do baby lipo, but not pediatric lipo. But they're little tiny instruments. They're very cute. We have them made in South America where the best machinists are. And we kind of create our own curves so we can make little pokes and get around ankles, get around knees, get into the calves, get into that sweet spot, Zen zone, just under the skin where that stubborn fat lives. We also have these new type of compression.
Is this like cannulas? Is that what you're talking about? Like sucking out fat from tiny spots? Okay.
But the ones that if you go to one of the meetings and you go to the marketplace, they don't make these things. So you have to get them custom made.
You have to get them custom
I was about to ask you, is this only yours? Is this proprietary or is just like only a few really good doctors have them?
I make my own based on like the way I like to operate, like the angle I like, the size of the cannula I like, the way that just makes sense to me. A lot of people who do these operations will use traditional things that I find when you're trying to do it on a high level with a lot of finesse just doesn't work. It's a square peg in a round hole. So they probably try it, they get a bad result, and they just bail on it instead of saying, this is a problem for patients, like let's find the solution. A lot of people probably just use what they have in the cupboard instead of trying to go and...
Or they say, no, we can't fix your ankle.
Yeah, they say, go to Neinstein. He's the crazy guy who'll do your calf and your ankle, minimally invasive or under general. We did a Pilates instructor's calf and ankle the other day, and, she was teaching again in a week.
Wow. Yeah, see, we hear about lots of different body procedures. Jen and I have talked about them over the years, but, I don't see too many, like the body procedures are big, there's no shortage of body procedures, but to you, they may seem very, unsophisticated. We're talking about just like, lipo or breast implants, like just your run of the mill stuff. We don't see too many specialists such as yourself. Why do you think that is?
The era, people maybe don't appreciate in general in life hyper specialization as maybe we once did. But to me, hyper specialization is everything. It's not just me. Like, we have a staff of almost 30. Like, we have 30 brains thinking about one thing all the time. And
but that's your practice. Like, what I'm confused about, and I'm going to cut you off, but what I'm confused about, and maybe I should have said this a little bit more clearly, is like, body is so big. Like, there's no shortage of people. Yeah, there's so many people who want breast implants, butt lifts, liposuction, laser liposuction. Like, there's interest in the body, but there are not a lot of people who are specializing it the way that we see face. So why is that not in alignment?
From a 30,000 foot view, I think a lot of doctors, as they're setting up their practice, have the idea, I don't want to put all my eggs in one basket. Warren Buffett says, put your eggs in one basket and hold on tight. And that makes sense to me. I'm just an all in. I want to be thinking about one thing all the time. I want to be thinking, And this is why I write the textbooks and give the lectures. And I'm constantly, I want to be nudging this operation millimeter by millimeter every day. Every day I want to be moving towards a better result. And that's just not what I'm doing in the operating room. What are we doing pre-op? What are we doing post-op in terms of all our, how are we analyzing our patients, preparing them for surgery? How are we taking care of them after surgery? And when you're always doing that for one operation, I feel like you can really get a hold of it and really have a sense that we're moving this in a positive direction. There's nothing stale here. It's constantly evolving. And that's the way my brain works is I don't get bored doing one thing all day that I'm really good at. It's stimulating to me. It feels good to do things you're good at.
I get that. And you also are in a metropolitan region that can support such a specialist.
Correct.
So that probably helps.
From a logistics point of view, we have the density to support hyper-specialization. If you're practicing in wherever in the middle, I won't say the middle of nowhere, but like a place with a low density, and there's not enough people to support.
There's not enough ankles.
Calf and ankle. Well, there's
he's not just the ankle guy. We'll get to that.
There's two ankles on every person, by the way. So there's a lot of ankles out there. So
2 for 1. He's running a special. No, okay. We talk
by the way,
about?
We're not running a special.
Don't do babies. We're not running a special. Can we talk about? We've been hearing a lot from doctors about how the pandemic has changed their practices. The Zoom effect, where people were seeking out facial plastic surgery, minimally invasive cosmetic injectables because they're looking at their faces all day long. What have you seen in your practice that's changed in the last 2 years because of this huge cultural shift?
So from one thing was we were always busy. I don't think our numbers have gone up in terms of the number of surgery because our schedule and waiting list was always packed. But we've gone international because we pivoted immediately to digital. And I can't believe we didn't really think of it before. But the day they shut us, everyone was shut down. It was like, okay, now we just do consults virtually. And with our web through social media and word of mouth, all of a sudden, you didn't have to live in the tri-state area to see me. It wasn't just Connecticut, New York, and New Jersey. So instead, the first thing that's happened is 30% of my practice now is out of state. And within that, a lot is Europe and the Middle East because I can get on a Zoom just as easy to London or Kuwait or Nebraska as I can with someone who lives 3 blocks from me. So we've increased the pool of people. So it's now a global practice.
What about the bodies? Like, are people doing butt stuff because they've been sitting on their butts for 2 years? Like,
so
what's changed as far as what they want to get done?
This is the sense that I get from my patients, and specifically a lot of these big mommy makeover patients. Health and wellness matters. Health has never mattered more. Like, we literally all face death. So there's a lot of you know what? I'm going to take care of myself, and I'm going to do this for me now. It's not, I don't see I sat on my bum and now I want my bum done. It is,
I am taking control. More like a bucket list kind of thing. It is
more of I sat at home.
Life is short.
Life is short. I'm going to do the thing I thought about and just never got around to. The other thing is a lot of the professional, I operate on a lot of doctors and lawyers who were never going to come see me at 11 a.m. on a Tuesday because they're so busy. But now they can do a consult virtually, either, early in the morning, late at night. We have a lot of flexible hours for that because we have a global reach. And we'll just make it work for patients. And they can just come for the operation. And because we're so hyper-specialized, there's not a lot of diagnostic dilemma. Like, I can tell what your operation is. If I do 3 operations, I can tell what it is talking to you on Zoom. So they can just organize their surgery a lot easier. So
I see.
Going digitally has allowed us to go global. It allows us to hit people who couldn't come to see me because they're just too busy.
Well, they still come to you for the surgery, but you've been able to do all the pre-op stuff via the interwebs.
Correct.
Don't you need to feel the body? Don't you need to there's so much of it is tactile? Don't you feel like you need to feel the fat?
Well, after you felt 10,000 bodies.
Yeah.
And my wife, this is a professional discussion, but you get a sense. And I know what the operation is. We leave a little bit of variability if we have to pivot on the day of, but it's pretty rare that we change our plan. People from all over the world.
Dropping trow and sticking their butts in their webcams for you?
Correct. But we have it on a protected link.
Of course, because this is medicine. Yeah.
Yeah.
No, I'm just picturing it like you during the pandemic, just seeing a lot of people at home showing you. But of course it makes you're doing your pre-op. It would have happened in the office. Why not do it online?
There's a safer psychological threshold than, walking into a stranger's room, being into an office and being like, hey, take your clothes off. The doctor will be in a minute. You can kind of prepare yourself. You can do it in the comfort of your own home. You know, there's a lot of time, there's like a walk-in closet. You feel comfortable. You can set the stage.
Turn up the heat so we're not freezing in the paper gown.
You also can wear what you want versus like, you know, our paper gown and disposable under, you know, they can kind of say, hey, I only want, you know, to show you this. So that's why I put on this. You know, people who are busy working, it's like a lot of clothes on and off coming in for a consult. It's like when they're home, they can kind of plan and prepare them. It like makes it a little easier. They don't have to, if they're in their work clothes, it's a little, they can plan. Yeah.
Well, we wanted to speak with you in part because we hear you have one of the most tricked out offices in the city. You're on top of Bergdorf. You have all of the robots and gizmos and technology, including the custom-made ones. So we know that you know what's the hottest and newest. What are you really excited about right now? Like, what technologies are you excited about? What procedures?
I think it's important to say when we signed the lease here, I'd never even been to Bergdorf's. My wife, I didn't even know what it was. That's how, you know, hyper focused I was on the work. You know, my wife convinced me that this was a good location, but the view is what sold me on it because we have, you know, a whole floor with Central Park views. I was like, that's great. And that is really going to inspire people. And we were able to bring kind of our energy to life in a physical space. And it really helps your staff. It's really nice to go to work in a place they love to be at. But when it comes to the technology, and yeah, we are tricked out here. A lot of it is tools that are taking the procedures we do and just nudging them forward. There's not going to be magic and it's always the person holding the tool. It's not the tool itself. You know, it's not as a photocopier. But what I'm liking and loving is the ability to melt fat so things come out smoother and easier. That's with our Vaser ultrasound technology. And they keep coming out with newer versions, which allow a more streamlined delivery of energy. And skin tightening. And the skin tightening, which is a very good adjunct. Its ability to heat the skin from the inside and cause the collagen to remodel or tighten, like tying an old shoelace knot. And that we're using plasma technology in the office. And that's the surgical stuff. When we flip over to the non-surgical side, we've really loved the muscle building technology with EmSculpt. I love EmSculpt. It's like, who doesn't want more muscle? And it is just like a jump start or a catalyst for your workout plan. And especially people who have body sculpting procedures, we bring the skin down to the muscle and then we can bring the muscle up. And putting those together, we can really give people a head start to the best version of their body.
So wait, do the surgery first, and then they come back and somebody else in your office does the EmSculpt on them to finesse the finished look.
Yeah, and that goes along with their wellness, like their exercise routine. And that's why we just get some of these incredible, like mind-blowing outcomes.
So Jess and I were wondering about the exercise thing, because I think a lot of people come for a body procedure and they're like, it's done, I'm fixed, it's good. Like, what have you noticed that makes a difference and makes a better result as far as how they exercise?
It's the people who exercise a lot pre-op, who are like, not a lot necessarily, like, no, so it's not necessarily, you don't have to be a fitness junkie, but people who take care of themselves, like, this is how I live my life. I eat pretty well. I'm not a monk. I exercise a good amount, but you know, I'm not crazy. Mm-hmm. And this is how far I can take my body. And like, if you can safely and predictably take it a little farther, I can maintain and enhance that through my exercise. The most common thing I see for my female patients, which is the majority of my practice, that makes a big difference is Pilates type exercise. High, low weight, high rep, this fast twitch kind of exercises really help tighten things from the inside and help create those long, lean lines. The powerlifting stuff tends to give a bulky appearance. And I find most of our patients are looking for that long, lean, elegant, athletic look, not bulky look.
Okay. So Pilates it is. Got it.
Let's talk about some of your procedures. I was interested in the breast boost, not personally, but just like want to talk about it. How is this different than an actual lift?
So we see a lot of patients who are maybe a little deflated from breastfeeding or just looking for a boost or a perk to their breast size. And there's a lot of women who are just adverse for whatever reason to breast implants. Mm-hmm. And since we're basically doing some type of lipo or sculpting on everyone, we have these, amazing regenerative material from them called fat. Mm-hmm. So what we like to do is we get the fat out from whatever we're doing, purify it, and re-inject it. And when we're re-injecting it, we are able to enhance the volume and alter the shape. But there are limitations compared to implants. If the patient is hypermetabolic or like an extreme exerciser, they can kind of lose some of that fat, especially if they have any dramatic weight loss after surgery. So we think you predictably get an increase in about half a cup. So this is something that
from a fat transfer.
Yeah, you get about a half a cup. But the technology we use to put it in vibrates. So a lot of the times, it's not like I'm pouring a can of Coke into the breast. We were able to expand the tissues within the breast so we can alter the shape while we're enhancing the volume versus
Can
just
you choose your shape?
Yeah, can it say where
we're
you
pretty
put
much
it?
set on like a nice breast shape. Like if someone asked for a weird breast shape, we wouldn't do that.
Yeah.
There's not a lot.
But like everybody has different breast shapes. Like what if you want, I need more on the left, or I want a teardrop, or I want a rounder.
So yeah, there's a little bit of wiggle room there. We always want to give our patients agency for decisions about the way the outcome is. We do not set, the standard. We work with them on what is reasonable, what is safe, and what is predictable. We're really just trying to revolumize after breastfeeding or slightly alter the shape and size in people who have not breastfed.
How long does that last?
Yeah, that's my next question. Remember I said I wasn't interested, and now I'm like totally interested.
At about 3-4 weeks, like what you see is what you get, meaning like those fat cells that were once in your calf or your waist that now live in your breast that's your living and breathing tissue.
That's
so they're
awesome.
going to stay with you forever. But if you have dramatic weight loss, they may come down. Dramatic weight gain, they may go up, but they're going to go up in proportion with the rest of your body. So
Well, they don't like remember that they're a butt cell, right? Like if you tend to carry your weight in your lower half and then you move the lower half fat cells to your upper half. You know what I'm saying here?
Yeah, no, fat cells have very little memory. They're like they're poor students. They're like awful memory. No, they just live
they
where
just want to like volumize and devolumize. That's all
they
they're
just
doing.
want to eat and live like the rest of us.
Okay.
So that's like an add-on procedure. We do probably every day. I do a breast augment. So, and then if you want to get like a little inside baseball or get granular, we use specific technology to purify the fat. So, we get all the fat out and then, we kind of get rid of the schmutz. So just the good stuff that's left over. Mm-hmm. And we're injecting it in a closed system, which means it's never exposed to the air. It kind of comes out, goes through a tube, goes through a machine, goes back in, looks like a little bit of Willy Wonka factory happening. Yeah. And when we're injecting it, we're using a little vibration tool. So we're putting little pieces everywhere. So we're not putting it all in one spot to try to add a lot of volume. We put little pieces everywhere to increase the chance that each little piece will get its own blood supply and survive. We use special...
So you have better results than a typical fat transfer that we've been
it's a lot of
about.
equipment, a lot of technique. Where you place it, we're placing it like just under a certain amount, just under the skin, a certain amount within the breast gland itself. We are adding a specific amount in certain depths because we have the instrumentation and know-how to do that, to get a more predictable, nicer result. And that just comes along with doing a lot of them and investing in the technology and techniques to do it.
Okay, so if somebody hears that, another doctor does this, they may not be doing it the way you're doing it.
Yeah, like you don't want to just like take fat out of a stomach in a syringe and just shove it in the breast. Like that's not the procedure.
Okay.
Are people doing that?
I don't know what anyone else is doing.
I hope not.
Laser focused here.
Yeah, okay. So another procedure that you alluded to before is the mommy makeover. And listen, I do think I just need to call it the elephant in the room. Some people find that like term a little like, well, why do mommies need makeovers? You tell us why not mommies need makeovers.
So mommies definitely don't need makeovers. They're everyone is perfect in their own sense, but it's that sense of self. So one of the reasons I love, procedures that deal with some of the changes of pregnancy, a lot of those patients come to us, they've never had aesthetic surgery before, and they're coming almost in a reconstructive sense.
Okay.
My core is broken. Okay. I look like I'm 9 months pregnant. I haven't had a kid in 8 years. I've been doing planks for 8 years. Nothing's changing.
You're talking about abdominal muscles.
Yeah. Or this skin is, I'm 108 pounds, but my skin is hanging down to my knee because I had 4 kids and like 2 of them were massive. So there's a low psychological threshold to make the change. They're thinking about it almost in a reconstructive nature. They're young, vibrant people, or whatever age vibrant people. They look in the mirror and they're like, my body is broken. Like this is not normal. I have to wear a ton of contraptions to either hold my muscles together or roll my skin into my pants. And so those patients have such an amazing emotional recovery from the operation. It is not a typical cosmetic patient in the sense of I'm just coming in to alter or change this. They're really trying to fix things. So, and being someone who, has a young family, I see the emotional changes that pregnancy does to someone, and that reversing those and enhancing those really brings a lot of sense of self to people.
Sure.
So that's something that I've just really decided to focus on. And it's something that's a huge part of my practice.
I totally understand everything you're saying. So can you walk us through some of the different, I don't know, does a mommy makeover include all of those things, or can people pick like a la carte?
It's a catch-all phrase. Basically what we're doing.
Sounds like a lot of work.
It could be a lot of work or a little bit of work. And that's why, as someone who focuses on these procedures, not all moms are the same. Not everyone, it's not like here's one procedure. So we come up with a custom operation for everyone. And even if I took 5 people that look exactly the same, we might do 5 different operations because they may have different desires, expectations, downtime, or like scar tolerance. So typically we're starting in the abdomen, and when we start in the abdomen, we typically always start with contouring. We'll recontour the waist and the abdomen. That's with our lipo. And then we're going to address the muscle. So if the muscles are severely separated, patients feel like, they do a plank, their stomach falls out of them. They're getting out of the cab, like they're going out to the left, their stomach goes to the right because their core used to be, something that they relied on to hold everything together. And now they can't rely on it because it's not holding everything together. The muscles are in a non-functional positions. We want to repair those. We can get access to those muscles with a mini tuck if they have very little loose skin, or we can do a full tuck if they have a ton of loose skin. And some of the things that we're innovating and working with our colleagues in South America is instead of just getting in there and putting the middle muscles back together, we're now putting the side or the oblique muscles. We call it a multi-vector muscle repair. So we're putting things back, not just in the traditional sense, and that can help recreate waistlines that, a lot of patients come after pregnancy and they say, I look boxy. I feel like I look like a box because as the muscles separate, the core and that corset look of the female core separates out and gets a little boxy. So we'll go and fix that. So we're fixing we help deal with stubborn fat, recreate the contour, we'll fix the muscles, and then we'll get rid of the skin. We can get rid of the skin with a mini tuck, which is something about the size of a Nerf football. We can do a full tuck if they have a ton of loose skin, they were really stretched out. And one of the things that I like to do a lot is we pull up. I call it the reverse mini tuck. We'll put a scar underneath the breast, hit like a breast implant scar, and take out like a banana design of a skin and lift up for people who have loose skin above their belly button. And we'll make all different combinations of these depending on the patient.
Wow. We want to introduce you to Clinique's first foundation designed to be the last step in your skincare routine. Even Better Clinical Serum Foundation is formulated with 3 serum technologies that visibly reduce dark spots, brighten, and hydrate skin.
This one's really a game changer. The first time I used it, I realized I had to stop thinking about this product as foundation. It really is the serum. It's the serum step in your skincare, but it also has the tint so you don't have to do the foundation step. The serum is legit. It has vitamin C for brightening, and that's what I really noticed a big difference with. It's also hydrating, so you're getting brightening, hydrating, and it's smoothing. It helps to sort of retexturize with a little bit of salicylic acid. Oh, did I mention the UV protection? It's sort of like, how Jess, you and I talk about we need everything all in one. Here it is.
All in one. This hydrating foundation formula provides buildable medium to full coverage with satin finish. I love that it's oil-free, waterproof, and sweat and humidity resistant. It's available in 42 shades.
Find your shade with Clinique Clinical Reality Shade Match Science. It has a virtual try-on. You can't call this makeup. This is skincare in just your shade. Find your shade today at Clinique.com. What about the people whose muscles have separated, who have been told that they can't ever get their regular abdominal wall back? Can you fix that deep kind of thing, or is this more the aesthetic?
Listen, there's no such thing as perfection. It's always the pursuit of perfection. We can put the muscles back. I mean, obviously there's always going to be outliers. I can't think of any, but I'm sure there are. But we can
that's
put the
good to
muscles
know. I hear that that's more common than you would think after a pregnancy, and a lot of
No, we can put the muscles back together. And, we do a lot of these mini tucks. We actually did 2 of them today. There's a lot of fit moms who don't have a ton of loose skin, but their muscles are separated. So they kind of walk around looking round, but like they're also very small. And a lot of plastic surgeons say, you have to have a full tuck. And they're like, I don't really have a lot of loose skin. Why do I have to have a cut from hip to hip? So I've kind of created this technique where we can make a small scar, 4 finger breath size of a mini football, that's just like above the that's hidden in the underwear bikini line. And we have instruments that can go all the way from the pubic area to the ribs. So we have instruments that like I can sew from the groin all the way up to the ribs and put the muscles back. So we don't have to make that wide tummy tuck incision if they don't need it. So we have options. And then at the same time, we'll address the breast, whether they want to lift, an implant, a lift with an implant, fat transfer with a lift.
Do you do vulva and vaginal surgery also?
Nope. Not at all.
That's where you draw the line.
That's a firm. Well, listen, actually, to be serious about it, I don't do it because I'm not trained in it. I'm not a gynecologist. I really believe you shouldn't do an operation. You aren't able to treat all the complications. And I think if you're going to do vaginal surgery, first of all, you should know how to do a proper vaginal exam, know all the diseases, illnesses that can arise that you can find on. And I'm not trained. It's not like I don't need to play around.
No, I think people hear mommy makeover and they're like, I walk in, I walk out with a whole new body everywhere. So it's good that we've clarified what exactly you're talking about.
It's mostly the core. It's the skin, the fat, the muscle, mini or full, reverse mini, like all the different variations. We do that. That's why people come from all over the world because we'll customize it to you with the breast. And then, a little bit of buttock sculpting sometimes and a little bit of extremities. But these... just to paint the picture, these are big operations. Just because you don't have a big scar doesn't mean it's not a big operation. This is a big recovery, and we have a whole team. Like, this is a lot of aftercare.
Yeah.
And so, like, when we talk to patients, it's not like, we're going to do this, this, and this. It's like, it's a big operation. It's a big commitment. We're all in. We need you to be all in.
Yeah. Let's talk about the tush. What's going on with the BBL, state of the Brazilian butt lift? What's happening? So, I feel like every year we've got to check in. Like, is it still hot? We still doing them?
So, everyone has different aesthetics. In my office, we talk about better, not bigger bums. I put in a little bit of fat to reshape the bum and call it a day. Just under the skin, super safe. We don't make big bums. It's just not part of my thing. There's lots of people who do that. We just try to give a little perk, call it a day. So we do a lot of little fat transfer for a better, not necessarily bigger bum. We're just trying to help with shape. I find that's incredibly safe, incredibly predictable, gives you a long-lasting, nice aesthetic result. There's no cartoonish look. There's no odd look. It's not a fad to have a nice bum. You don't need a massive bum. That's not my thing.
Or are people mentioning that that phrase, Brazilian butt lift? Because I feel like that phrase is still I put it in Google the other day. It's still trending.
Yeah.
I know it's not your thing. I'll clarify. It's not your thing.
I mean, we do a lot of fat transfer to the bums. But when you hear the term BBL or Brazilian butt lift, you think super narrow waist, super big bum.
Right.
So patients will say, that's why a lot of the times we'll call it an athletic BBL. Patients will say, I'm interested in athletic BBL. Or they'll say, what can we do about my bum? I don't want it bigger, but I feel like it's kind of droopy or doesn't have the shape I really like.
Right. Okay.
While we're on this topic, I have to ask, because I know you're going to be honest with me, do people get their lower rib taken out to make their little waist little? Or
not in America, but I have a friend in Colombia who does it, and he's presented pretty amazing lectures, scientific, not like nonsense.
No, I'm being serious.
When they're doing a tummy tuck from the inside, he uses a harmonic scalpel, which is a way of cutting without causing a lot of heat, or they do remove floating ribs to reduce the waist. To me, just because, that's the Jurassic Park stuff. Just because you could doesn't mean you should.
So you draw the line at taking out
yeah, because I think it gives awkward appearances. I think you get, you don't need a waist that, I can put my hands around it. I just think that goes over the line of elegant aesthetics
Yeah.
But just like everything, there are people who want that.
Do you see that happening here?
I don't know. I don't know anyone who's doing it here. I'm sure you can always find someone if you look. But like, I like my ribs to cover things like lungs and hearts. That's like super important to me.
Medically,
you call me old fashioned. Huh? So
wow. Did you share your opinions with this doctor, or did you keep them to yourself?
I mean, he's a very safe, reputable academic guy. And, they're not taking they take ribs for noses all the time here, right? No big deal. Take a rib, like you guys here, they do rib rhinoplasty. They take a piece of a rib. So there are things you can do that's safe and predictable. And, maybe in a few years we'll be talking differently. I just think that that's outside of my realm of safety.
You mean like a bone graft? Like if someone needs a little bone, they get it from the rib to put it on the nose kind of thing?
Yeah.
Okay, yeah.
But,
we're not, that's not removing an entire
You're removing part of the rib. I mean, it's in the same family, so it's
Full disclosure, I have had a rib removed.
There you go. So here we go.
Not the lower. It was for thoracic outlet syndrome. So it was like a top rib, but I have it in a jar literally right over there. So
Jen,
I know what it looks
things.
like. And
Okay.
you knew this, I felt like.
No, we talk about it offline.
So, removing ribs can be done safely, but like that falls outside
Mine
of
was for a medical reason. It wasn't because I wanted like a tinier waist. Yeah.
Correct. Yeah. Listen, we don't do it. I don't know anyone who
I hear
does
that
it.
rumor all the time. So I was like, let me ask Dr. Neinstein. He'll tell me the truth. Okay.
Yeah.
Wow.
Interesting.
If you really want more of your ribs removed, but like you're running out of ribs here. No. I mean, you already had some. Like,
oh my God.
You gotta
no, I'm good. I'm good. I've got what I need.
You gotta keep some of that. Keep your ribs. But I know who to send you to.
Okay.
Wow. Okay. Good to know. So let's also talk about some of your patient demo. You see a lot of men in your practice.
Yeah, we have about 30% male. Same type of person. A-type, eats well, exercises, knows their limitations. Men have a genetic predisposition in general for man boobs and flanks. And like a lot of us, no matter how much you starve yourself in exercise, like they stick out. And especially with the type of fashion, a lot of people like to wear tight things and like they see their chest and they see their flanks like spilling out in their tight t-shirt and their tight jeans. And those are slam dunks. It doesn't create a feminizing.
So what do you do there? Liposuction for like
liposuction with a little gland removal in the chest, liposuction in the waist. You can sculpt them in a very masculine way. We're not trying to create a feminine silhouette. We're trying to create that kind of Romanesque V. But mostly with the men, it's just a gentle, like, just make my chest flat and like get my flanks out. So like when I wear all these nice clothes I bought, I feel comfortable in them.
When you say gland removal, you're talking about chest? What
some of the extra breast gland, gynecomastia is the medical term.
Mm-hmm,
yeah.
Mm-hmm.
And we can get a lot of that out through the armpit now, so you don't have that big scar around the areola.
Is that hereditary? Like, when you said man boobs, I'm not being trying to be funny.
All men have breast tissue.
Yeah.
Typically at puberty, just for whatever reason, some will have a little bit of sensitivity to estrogen that's floating around, and they'll grow more breast tissue, and that kind of sticks around. There's certain medications, diseases, and illness throughout life that can cause excess breast tissue growth.
Yeah.
But most of it's what we call idiopathic. They'll say, I hit puberty, grew, I haven't been able to take my shirt off at the beach, and like I've had enough.
Why do you call them flanks, not like love handles or whatever? I don't know.
So
the medical.
This is a good term. We call the waist in females the waist, and we call the waist in males flanks. And that's not ubiquitous. And even though I've written that in medical textbooks, there's no this bone, like the arm bone is like a humerus, like that's like accepted in medicine. But like male and female waist, like because it's soft tissue anatomy, like doesn't have a defined term. But just to break it down, we call waist in men flanks and waist in female waist.
I see. Okay, speaking of waist, we've been talking a lot about fat. So we have to ask you about CoolSculpting. It's had a lot of news lately. Clearly, we all saw what Linda Evangelista went through. And we wanted to ask you what, in your opinion, is going on with CoolSculpting.
So I think the technology was really good. Like it's pretty cool, like innovative technology in the way they found it. And then I think, the device just became super popular and was everywhere. And if you told me you could get surgical results without having surgery, I would be sitting here with a CoolSculpting device on eating ice cream. But that's not reality. So I think they're just applying this device to everyone who comes in, who just is willing to have it. And I don't think you can put the same device with the same, settings on me, on you guys, on Shaquille O'Neal, and press a button and expect the same result, right?
And who's they? You're saying they applied. Are you saying they, the manufacturer, or
the manufacturer, the people using it? I don't think anyone has any malice, by the way. I don't think anyone's trying to do anything but help their patients. And I think that just because the technology is applied so ubiquitously and you're anticipating the same type of energy in the same way is going to cause the same result. And everyone, every operation I do is customized and unique to that person. So what's happened? So this device, you apply energy from the outside and you hope the fat goes away. Well, sometimes it goes away and sometimes it grows. And sometimes it grows and gets encased in scar. I mean, I had a patient.
Could that also happen with traditional liposuction though?
Well, that's under the skin. We're taking the fat out. We're not playing with it from the outside with a UFO. I mean, we take it out. Like, we're not playing around. I mean, some of the growths that we see, the so-called PAH, which is the basically growth of fat from CoolSculpting, some of them are like, we had a woman from Australia who had an upper abdominal fat growth so much she could like put 2 wine bottles and like 2 wine glasses on it. It was like a full shelf. I had to cut it off. Like,
whoa.
It was pretty... it was a pretty good party trick for a while.
Why does it grow? Like I wasn't aware.
If you put energy from the outside, hot, cold, whatever, and hit the inside, almost like it's just as likely to grow as it is to like shrink. Like how do you tell the cell what to do, right? So every now and then the cells say we're going to grow instead of shrink, and because it's uncontrolled
and you can't
energy.
predict which people that will happen to.
Yeah, there's some like hints. Maybe it's this type of person, but like no one really knows. But I operate probably 5 to 10 people a week who come to see me, who say, and the story's all the same. I was thinking of getting lipo, but then like my XYZ doctor said, why would do lipo? Like just sit here and watch Netflix and like put this device on. You'll get the same results. And then they obviously didn't, and it got worse. And then they need a big operation. So we've created like our own protocol for treating them, how we can melt the scar, smooth the scar, remove the fat, and treat them after. And we treat a lot of these patients from around the world. Like I think, people from Australia, Europe, Middle East, and, everyone few and far between in the United States.
Are coming for CoolSculpt revision.
Yeah.
Got it.
Okay.
Are there any other procedures that give you pause then? I mean, there's ones with heat that do something similar. So...
yeah, I mean, I think
or
you need...
not even with fat. I don't know. What wouldn't you do?
I think the pause is really... a lot of the times the story is, I did this treatment and it didn't work. Or like they didn't notice a change. And then they said... so they went back to wherever and they said, well, just keep doing it until it works. Mm-hmm. I think if you do something and it doesn't work, like your body's telling you not to do this. Like it didn't work. Like don't keep doing it and expect a different result. And I think when you keep piling on trouble, eventually you get into it. So
it might work for some people. Like you mentioned that CoolSculpt works for some people.
Most people who get, from my experience, and this is like they were getting the problems with CoolSculpting after like multiple sessions. So like if the first one didn't work, you should just bail. So I'm not saying all non-surgical devices are nonsense. Not like there's a lot of R&D. These are real companies. They get FDA approval. But as opposed to surgery, I think that if it doesn't work for you the first time, like get out. And by the way, if it works well, stop. Like be careful. There's a lot of faith and trust in doctors. And it's like, if my doctor has this device, it can't hurt me. Why would they want to hurt me? And they don't want to hurt you. But there's a lot of uncontrolled variables with devices.
So then how do we know that you have devices that you are non-surgical in your office that you love? How do we know that those are safe?
Correct. So there's definitely a risk that they're not. But what I like is that they don't target skin or fat. Like I'm trying to grow the muscle. Like I want.
Oh, you're talking about EmSculpt, not.
That's the only device I have.
Okay.
We don't have anything that applies energy to skin and fat.
Okay.
Yeah. There's the only energy that stimulates muscle cells. Like if your muscle grows too much and you're too ripped, we'll deal with that. Yeah.
Yeah.
Okay. Okay. Because you raise a really interesting thought there. And I definitely want to follow up.
And I don't know if you want to air this or not, but the way they sell devices is to doctors, you earn a living by using your 2 hands, and like you only have so much time and you only have so many hands. So why not get these devices that can run without you as like a way to make passive income in your practice, which is very enticing to a doctor. So that market will always be there because the doctors are always going to be interested in that.
So how do you find a good surgeon? Because this is a question we get in our DMs all the time.
Gotcha. I mean, it's difficult, right? Like, how do you find a good lawyer? How do you find a good accountant? I'll tell you, when I want like a professional service, the number one thing that I do, I start with a professional that I've trusted. Most people at some point know someone that they trust. And so, if I need an accountant, or a new accountant, I'll ask a lawyer of mine that I really trust. Hey, who do you like? And then I actually go and want to see them. But now we take a step back. When someone says, I'm interested in this person. So what I would do, I would actually look at the reviews and look at it with an open eye. Like, if I'm going to go on Yelp for a restaurant, I like restaurants that have a lot of like reviews. Like, even if some of them are bad, like I like a lot of things are happening there. These places
is important.
There's action there. Okay, these guys are doing things and some of the reviews are going to be bad, and that's okay too. But
you're not talking about Yelp, like truly go on Yelp.
No, but you want to get a sense of is there things happening there?
Where do you think there's a good review?
Google reviews, Real Self, and even look at Yelp. By the way, and with the negative, is there like just a couple oddballs that seem a little quirky, or is there like a very consistent very certain thing that all these people are saying and that should be addressed that is not being addressed? Or you're just there's some quirky people that don't mesh. And then I do think social gives you does give you an insight into their world. Like our social is basically unedited. It's pretty raw. This is what we're doing. This is who I am. This is, I get up at 4 a.m. I read, I exercise, I go to work. This is my family. This is what I do all day at work. And these are the people in my office. You can learn their personalities, get a sense of it. I think you're at the point now, you don't need, you want to get a sense of who they are, the reputation. So it's putting it all together. Word of mouth, online reputation, how they portray themselves on social. I wouldn't go see a doctor who's showing off going to nightclubs. To me, that's what is this person doing on weeknights? If they're showing you,
what time do you go to bed if you're getting up at 4 a.m.?
9 o'clock.
Okay, we got to wrap this up soon.
Exactly. It's almost bedtime. But So it's word of mouth, reviews, social, and then go see the doctor. And then honestly, it's just like dating. You'll get a sense. Do I like this person? Do I trust this person?
Yeah. Okay. Now that makes.
But there's no simple way.
Well, I've got to ask you this, and I'm really curious what you have to say about this, given your sort of strata. What about when someone offers a discount?
What do you mean?
There's a special.
Groupon.
Yeah, or blah, blah, yeah. A
buy
discount.
One, get one free.
Money off, yeah.
Well, I think in just like every business, people are going to have different models. So, Walmart makes more money than Balenciaga, right? So those are sophisticated businesses like corporate breast places, corporate lipo practice run by private equity groups that have 30 locations nationwide. They're going to offer a cheaper product and they may offer a lot of specials. That company makes way more money than the boutique doc, okay?
Right.
So most boutique docs, like myself and some of the other doctors you have on, that have a big infrastructure to provide not just the surgical procedure, but the experience. There's 25, 30 people involved in a surgical experience. So it's not just the doctors charging a lot for his or her day's time in that operation. It's for this whole infrastructure to support you before, during, and after.
But are you wary of those larger corporate run entities that might offer?
It's not for me. I wouldn't want a family member going there.
But you're not saying that means it's bad practice.
If you have a budget of X and you really want to do it and you can't afford the doctor you want to go to, that might be the best option for you.
Yeah. So not an immediate red flag. Still do that homework you were talking about.
You have to live in reality sometimes.
Well, remember, if something's owned by private equity, these groups aren't in it to loot. They're not. You may think they're playing it loose and fast, but if they're
hiring reputable doctors to do the work.
But they're not investing hundreds of $1 million to buy a network of practices to loot. They're not trying to be dangerous. You're just probably not getting a good network or infrastructure.
Yeah, they wouldn't be in business if there was malpractice left and right. Okay, yeah, that's a good point.
You're not going to have the best of the best staff. You're not going to have the customer experience. You're not going to have access to your surgeon. You're not going to have their cell phone number. My patients can text me or call me 24/7. You may not even know who your surgeon is. Literally may never even meet them. They may literally just put you to sleep and whoever gets in the room gets in the room.
That sounds like a horror movie. Okay.
But just like every industry, there are hotels that are very cheap and hotels that are very expensive. Restaurants, But
it was the putting to sleep part that scared me. The putting to sleep and then the stranger cutting me open.
To me, surgery is such a big deal that I would tell someone I'd rather you like save up for it and do it right than just do it now because like your friend got her butt done or something, you just want to get it done because you don't want to be left out. Like it's something, parachutes and plastic surgery you don't want to cheap out on.
That's funny. Okay, hit us with a few of your favorite products, and then we know you've got to get to bed. This is making me nervous. Your early wake up.
We like the Scanuva aftercare product. It's a growth factor serum that we use for scar care as opposed to typical silicone. That works really well to make our little lipo dots or lipo pokes like fade. In terms of skincare, like I don't know anything. Like my wife, I just use whatever's in the shower. Like I'm like a traditional guy like that. But
you don't have any favorite products like a shampoo that like you love?
I'm literally like whatever is like there, like whatever my wife gets.
Cologne? You feel like a cologne guy, maybe?
No. I like shoes, sneakers, because like my outfit is
Okay, what are your favorite sneakers?
We are big time APL people. Like,
okay,
I have like 80 pairs, every color. In my office. Like, I like it brings out like the energy. I like all the different colors, confetti.
Wait, your shoe collection is in your office?
I have a shoe collection in my office to wear in the office. And I like colorful, big hoodies because that's what I wear most. It's my scrubs.
You're a fashion guy.
It's hoodie and fun shoes. And so from the hoodies, I mean, that's where we'll flex. We'll wear like a torn Balenciaga sweatshirt and like walk in like to any hotel in the city where my patients are staying. And put Irish Spring
bar soap on your face.
No, I use fancy stuff. I just don't know what it is because it's my wife's. Like, and then,
I got it. All right. Before I let you go, got to hit you with the Fat Mascara 5, super speedy. I think I might know the answer, but what type of exercise gives your patients the most bang for the buck post-procedure?
Pilates. Don't call it Pilates.
Got it. What's your favorite type of exercise?
High intensity interval training.
What is the most surgeries that you've ever done in one day?
5.
Okay. Do you listen to any music when you're doing surgery?
I prefer country music.
Oh, who's on the rotation for the surgery?
We're very into Cole Swindell right now. Shout out to Cole Swindell if you're listening out there. Big fan, buddy.
I love it. And at the end of the day, it's 8:58 p.m. How do you unwind?
It really comes for me. The foundation is taking care of myself, like mentally and physically. I read a lot of philosophy. I exercise a lot. I sleep a lot. Or sleep as much as I can. And the real foundation, though, is the family. Like spending time with my kids, spending time with my wife, spending time with my 3 crazy dogs. I have 3 Chinese crested dogs.
So cuddles at the end of the day to unwind. Like what gets you out of work mode?
That foundation is everything. That home base, that safe place where it's all love. And, it makes you want to get up and be the best version of yourself every day because you're representing a team.
So family is how you unwind. I like that.
Beautiful.
Yeah. Thank you so much for coming on Fat Mascara.
Well, thanks for having me, guys.
Thank you so much. This was great. We hope you enjoyed the show.
It's your reviews and feedback that help us make the podcast even better. Head over to iTunes to rate and review us or email your thoughts to info@fatmascara.com.
We also want to answer your beauty questions and hear what products you love. To share a Razor One product review or to ask a beauty question, email us at info@fatmascara.
If you send it as a voice memo file, we can even share your voice on the podcast. You can also do that by leaving us a voice message. Our phone number in the United States is 646-481-8182.
Thanks so much for listening.